Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dorothy Shepherd, ministre de la Santé. Speaking on behalf of the province today, Dr. Jennifer Russell, the Chief Medical Officer of Health, and the Honorable Dorothy Shepherd, Minister of Health. Dr. Russell.
Thank you, Bruce. Merci, Bruce. Bonjour à toutes et à tous.
Good afternoon, everyone. Before starting, I would like to speak to people in Zone 4. I know that many people are very concerned and afraid right now in that area. I'm also very concerned, and so are my colleagues at Public Health. This is why we're sending all of our efforts to make sure that everything we can do in Zone 4 are being done. We're going to explain a lot of the situation today. We're going to try and paint a picture of what's happening now. I had meetings with the COVID-19 cabinet, the cabinet, and the leaders in Zone 4 this morning. We're trying to explain the situation clearly and understand what we need to do as a community to protect ourselves. New Brunswick has reached a crossroads in our journey through the COVID-19 pandemic. Our course forward will be determined by the 3 V's: vaccines, variants, and vigilance. We have accelerated our vaccination campaign with encouraging results. Over the Easter weekend, we passed a significant milestone with the 100,000th New Brunswicker having received a COVID-19 jab. As of yesterday, we have vaccinated 121,468 New Brunswickers with at least 1 dose of COVID-19 vaccine. Over the past 7 days, we have vaccinated 33,078 people. That's an average of more than 4,700 vaccines per day. We now have 18.4% of our adult population at least partially vaccinated against the vaccine. And by partially protected, I mean that we want people to be fully vaccinated, but at this point, our goal is to give everyone at least 1 vaccine by mid-June. That's our goal, to protect the greatest number of people as fast as possible. But even with 2 doses, there are still risks. This is why we need everyone, whether they're vaccinated or not, to continue to respect public health guidelines. It's very important because you can be protected, but the people around you in your community are not protected yet.
Determined by the 3 V's: vaccines, variants, and vigilance. We have accelerated our vaccination campaign with encouraging results. As a percentage of our adult population, we have, as of today, provided more vaccinations than our neighboring maritime provinces, as well as the provinces of Manitoba and Alberta. And we can take great pride in what we have accomplished to date, but there is still much to be done. Minister Shepherd will provide more details shortly on the continuing expansion of our vaccine rollout. But as fast as our vaccine effort is moving, it seems that the new variants of COVID-19 are moving just as quickly. And here in New Brunswick, we're living with the UK variant right now in Zone 4. Most of the cases in Zone 4 are UK variant, and it's very, very concerning compared to what type of COVID cases we used to see. This variant is much more transmissible than the original strain, and the sustained outbreak is happening despite our best efforts to limit it. We have moved more vaccines as a result to Zone 4, so that 28.5% of people over the age of 16 in Zone 4 have received at least 1 dose. And I continue to encourage people, if you are eligible, to get vaccinated. L'éclosion dans la zone 4.
The outbreak in Zone 4, driven by cases of the COVID strain first identified in the United Kingdom, remains very active and is deeply concerning. This variant, which is more easily transmissible than the original strain, has sustained this outbreak despite our efforts to limit its spread. Yesterday, we reported another COVID-19 death in Zone 4, an individual in his 30s who leaves behind a grieving family. I want to extend my heartfelt condolences to the family and friends of this New Brunswicker and their entire community. We all grieve with you today. We are also seeing record numbers of COVID patients admitted to the hospital, which is putting renewed strain on our healthcare system. The Edmundston Regional Hospital has reached capacity for COVID cases, and some admissions will now be diverted to other health zones.
Area has been at the red alert level since March 25th and will be staying at that level for the time being. And I want to demonstrate exactly why that's necessary. So you'll see a slide, and this shows the situation in Edmundston on March 22nd when the area was still at the yellow alert level. Each dot that you see is a confirmed case, and when there is a line that shows and when you see the line, that means that we've made a connection. And at that time, there were 19 cases with all but one clearly linked to other existing cases. And again, that was the picture at that time. Now, the second slide is what we saw in Edmundston as of yesterday. So there are 3 large clusters of cases along with several smaller groups and individual infections. We haven't yet established how these large and small clusters are related to another, but that is the work of public health right now that we're investigating. So there's also a group of 13 cases which remain under investigation at this time. Unfortunately, the restrictions put in place last month for Zone 4 will remain in effect so that public health can complete the contact tracing process and be assured there is no further spread in the community. This has been difficult, and I am convinced that we can and we will stem the tide of this outbreak. We are now doing contact tracing starting 72 hours before somebody is symptomatic, and we are asking the close contacts of contacts to self-isolate. This is a really good approach, and it is working, but I know that there is a lot of stress and anxiety and fatigue clearly up in that area. So what is required now is that all New Brunswickers actively apply that third V, which is vigilance. Now more than ever, every New Brunswicker in every corner of our province must follow public advice and guidance. Everyone must continue to wear a mask, maintain physical distance from others, and stay at home when they feel unwell. I'm assuming that most of the cases that we will continue to see that are travel-related will start to become only the UK variant, and if not that variant, then the P1 variant. This is what we're seeing in terms of trends. So we need to remain vigilant, and this is vital for vaccinated people as well as the unvaccinated people. So people who have had 1 dose of the vaccine, within 2 to 3 weeks will have very, very good protection, but it is not 100%. So you as an individual still have risks of having symptoms and transmitting. Rarely you could have the consequence of needing hospitalization and an ICU admission and even death, but as very, very rare. So what we need to see is everybody continue to be vigilant until we all have 2 doses of vaccine on board, which will be by September. But in the meantime, everybody has to act the way they did act before they were vaccinated in terms of protecting their loved ones and their community members who are not vaccinated yet. We need everyone's vigilance to give our vaccine program a chance to be effective and keep these variant strains at bay. Our continued success against COVID-19 depends on you. Aujourd'hui, Santé Publique confirme.
Today, Public Health has confirmed 7 new cases of COVID-19 in New Brunswick. In Zone 4, which is Edmundston-Grand Falls area, there are 6 new cases. 3 of these cases are identified as contacts of previous cases, and 3 are still under investigation. There is also 1 new case in Zone 3, which is the Fredericton and the St. John River Valley region. This is a contact of an existing case. There are now 146 active cases of COVID-19 in the province. This includes 20 individuals who are now hospitalized, and 13 of those are in intensive care. This is the largest number of COVID-19 hospital admissions at a single time since the start of the pandemic. It is the largest number of hospitalizations and intensive care patients that we've seen since the start of the pandemic. And I ask you to please keep these people in your thoughts and prayers. They're going through extremely difficult times. We need your thoughts and prayers. They are always welcome and appreciated.
Confirmed 7 new cases of COVID-19 in New Brunswick. In Zone 4, which is the Edmundston-Grand Falls area, there are 6 new cases. 3 of these are identified as contacts of previous cases, and 3 are under investigation. There is also 1 new case in Zone 3, which is the Fredericton and St. John River Valley. This is a contact of an existing case. There are now 146 active cases of COVID-19 in the province, and this includes 20 individuals now in hospital, of whom 13 are under intensive care. This is the largest number of COVID-19 hospital admissions and ICU patients that we have seen at any time during the pandemic. And what you will note when we talk about what types of people are now being admitted, earlier in the pandemic, it was older people, long-term care facility residents, etc. But now, because the long-term care facility residents and nursing home residents have mostly been vaccinated, we are seeing younger people being admitted to hospital and ICU. And not only because of the older cohort having been vaccinated, but also because of the variant. The variant is much more serious in terms of the symptoms that it can cause. In particular, the UK variant and the requirement for hospital ICU admissions as well. And again, some people may have been vaccinated, but again, it takes 2 to 3 weeks before you actually have the level of immunity that's required to protect you from severe symptoms of COVID-19. Please think of these fellow New Brunswickers and the difficulties they are now facing. Your thoughts and prayers are needed and always appreciated. It is gratifying to see how New Brunswickers are embracing the opportunity to become vaccinated against COVID-19. We are seeing strong turnouts at RHA clinics and pharmacies because New Brunswickers know that being vaccinated will help us move toward a more normal life. The vaccines have been clearly shown to reduce incidence of severe illness and death from COVID-19, and this information is being collected and tracked across the country. Provinces like British Columbia and Alberta, and here in New Brunswick, we're collecting that information as well, so we can clearly see how well these vaccines are working. It is worth noting that of the New Brunswickers now in hospital for COVID-19, there have been a few that had been vaccinated, but as I said, it takes 2 to 3 weeks before that immunity is really strong enough to prevent those symptoms. So I can tell you that there were a few people that were vaccinated that, again, they just weren't vaccinated recently enough to, or long enough ago to allow that, that protection. And I did have those numbers and now I don't. But again, it is very telling that, that again, the longer time frame after you get vaccinated, then you will see those risks of needing hospitalization go down if you do get infected with COVID-19. So those who have been vaccinated are at a lower risk of hospitalization, but the risk is not zero. And even after getting 2 doses, it won't be zero. So we have to really live with the idea that we are reducing the risk of hospital admission, serious outcomes, ICU admissions, and deaths. We are tracking infections that occur among those who have been vaccinated, and we have found that most of the cases are mild or asymptomatic, but the risk of infection will remain until the majority of New Brunswickers have been fully vaccinated. I am particularly pleased by the success of clinics that are being organized by pharmacies and that will provide the AstraZeneca vaccine to New Brunswickers over the age of 55. When we are required by circumstances to shift our strategy for AstraZeneca, we did put out word to our partners in the pharmacy business, and their response has been quite overwhelming and positive. Spreading the word in their communities, 132 pharmacies across the province have been recruiting recipients for 24,100 doses of the AstraZeneca vaccine, which are being delivered to some pharmacies. If you are over the age of 55, you can contact a participating pharmacy to book an appointment for your shot, though I understand these are going fast. So I do want to take this opportunity to thank pharmacists here in New Brunswick for their enthusiastic participation in this effort, and it shows how much we can accomplish when we all work together. We also have had many physicians step forward to offer to help with different types of clinics, and we appreciate this, including those who are coming out of retirement to help. This spirit of innovation and collaboration fostered by the pandemic has been harnessed in other ways as well. So during the first wave of the pandemic, we introduced My Health NB, which is a secure web portal where New Brunswickers can quickly and securely obtain the results for their COVID-19 tests. And with the support of Canada Health Infoway, a federal agency, the My Health NB program is being expanded to give New Brunswickers secure access to testing documentation. Tous les citoyens admissibles du nouveau
All eligible New Brunswickers with a Medicare card or federal health card will now be able to access and print COVID-19 test results through My Health NB. This will provide proof of a negative COVID-19 test result as required for travel or other purposes.
New Brunswickers with a Medicare card or federal health card will now be able to access and print COVID-19 test results through My Health NB. This will provide proof of a negative COVID-19 test result as required for travel or other purposes. They say that necessity is the mother of invention, and this pandemic has spurred creative ways like My Health NB to improve service delivery to New Brunswickers. These innovations will be with us long after the pandemic is over. We are now into April and spring has finally arrived in New Brunswick. It has been a very difficult winter for many of us, but nicer days and better days now lie ahead. With warmer temperatures and longer daylight hours, we can all get outside and enjoy the fresh air by ourselves or with our close contacts. A walk in the woods or along a trail on a spring day has many benefits for mind, body, and soul. And this is a critical point in our pandemic journey. In the weeks ahead, we must all remain strong, vigilant, and patient. After a year of COVID-19, it may seem that our store in these qualities has been depleted. But if we look deep within ourselves, I'm certain that we can all find that hidden reserve which will enable us to carry on. So please look after yourselves and look after each other.
The finish line is just over the horizon. With strength and with patience, we will get there. Thank you very much.
Merci, Bruce. Merci, Dr. Russell.
Thank you, Bruce and Dr. Russell.
Bonjour. Yesterday, we learned that another New Brunswicker has died as a result of COVID-19. Hearing this news has not gotten any easier as this pandemic has gone on, and nor should it. As well, the fact that this person is under 40 is a reminder of the impact of COVID and that it does not discriminate. Each person lost to this virus is painful for those who knew them and loved them. Our thoughts and prayers are with the person's family and friends as they grieve their loss today and in the days to come. Since the beginning of the pandemic, we have made it a priority to remain flexible. When we receive new information or when situations have changed, we have acted quickly and decisively to ensure that we are able to respond in a very timely manner. The same has been true for our vaccination rollout plan. We must be able to make adjustments to our plan based on updated guidance and the supply of vaccine that is available to us. Our goals have always been to keep New Brunswickers healthy and safe, and that goal has not changed. I know that at times it can feel like the advice is changing quickly, and that can be both concerning and confusing. That is why Public Health continues to work closely with health experts from across the country to ensure we are operating with the most up-to-date information available. Based on the recent advice from Public Health, Cabinet, and the All-Party Cabinet Committee on COVID-19, we've accepted the recommendation that we adjust Stage 2 of the New Brunswick's vaccine rollout plan. Stage 2 will still take place during the month of April and May, but we will no longer be planning separate vaccination clinics for home care workers or large employers. These groups will now be taken care of with the age cohorts. Focusing on age-based eligibility will maximize efficiency and allow us to react to changing supply chains as we work to vaccinate New Brunswickers quickly and efficiently with the vaccines available to us. While we are paused on plans to offer vaccinations through large employers at this time, we know that some pharmacies are being approached by workplaces to provide vaccination to people aged 55 and older using the AstraZeneca vaccine. While these clinics are not being organized by the province, when we have the capacity to do so, we will provide allocations of the AstraZeneca vaccine for the purpose of immunizing more New Brunswickers in a timely manner. Yesterday, we announced that anyone who is 70 and over is now eligible to book an appointment for their first dose of the COVID-19 vaccine through a pharmacy or regional health authority. If required, a caregiver or individual can book an appointment on behalf of someone who is 70 and over. To book an appointment through a pharmacy, check to see if the pharmacy has online booking or call the pharmacy directly. To book an appointment at a clinic offered by Horizon Health Network or Vitalite Health Network, you can register online at gnb.ca/book a vaccine or call 1-833-437-1424. Please only call that phone number to book an appointment at a regional health authority clinic. It is not an information line. Beginning today, rotational workers, regular cross-border commuters, and truck drivers may now schedule an appointment to receive their first dose of the COVID-19 vaccine through a regional health authority clinic. Previously, this group was eligible to book an appointment by contacting a pharmacy, and they may continue to do so if they wish. The regional health authorities have the capacity to take on additional appointments, so we are providing this option to make sure everyone who is eligible to receive the vaccine has the opportunity to be vaccinated in a timely manner. I want to remind everyone that it is important to schedule your appointments in advance, whether they are through a pharmacy or a clinic offered by Horizon or Vitalite Health Networks. Pharmacy and clinics know in advance how much of the vaccine they will receive and book appointments accordingly to ensure that all the vaccine is administered. Because of the need to plan in advance, it could take a week or two for you to get an appointment. Please keep this in mind when you are contacting a pharmacy or a clinic. Though our vaccination rollout is changing, it is still on track, and we fully expect to have all New Brunswickers who are 60 and over who want to receive the vaccine to be vaccinated by the end of May, and all New Brunswickers who wish to receive the vaccine will be vaccinated in this province by the end of June. We appreciate your continued understanding and patience as we move forward. I wish I could say that this is the last time we will have to change our plans, but that is not a promise that I can make. There are so many moving parts to this rollout, and there are countless people working behind the scenes to ensure that when it is your turn, you are able to receive the vaccine in an efficient and caring manner. I want to thank all those people for their hard work and dedication to keep New Brunswickers healthy and safe. As well, I want to assure you that we will continue to keep you informed as things change. None of this has been easy, nor will it be easy as we move through the next 8 to 12 weeks. But when faced with a challenge over and over again, New Brunswickers have risen to meet that challenge with resilience and courage. Working together, we will continue to do so. On March 19th, updates to the return to school plan were released that would see most high school students from across New Brunswick return to full-time in-person learning in the yellow and orange alert phases as early as April 12th. To support this plan, a province-wide vaccination program was rolled out for staff at high schools, and additional health and safety protocols were introduced for high schools. These include wearing a clean face mask throughout the day, unless eating or engaged in physical activity, ensuring additional spaces are available for lunch and breaks, and mandatory seating plans. In addition, Should a positive case be confirmed, high schools will close for 3 days to allow for contact tracing, school cleaning, and testing of close contacts, and vaccinations would be made available to students of that school. Today, updated guidance has been provided for high schools operating under the red alert level. When a zone moves to the red alert level, high schools will engage students in blended learning practices as they have been throughout the year. High schools where students have been able to previously engage in full-time, in-person learning will continue to follow their operational plan. As such, all high schools currently following red level protocols in Zone 4 will continue to engage in the blended learning model until the zone moves to orange or yellow. The full guidelines for the return to school plan are available on the Department of Education and Early Childhood Development's website. With the conclusion of the academic year fast approaching for students attending universities and community colleges, rules have been put in place to ensure the health and safety of students and anyone helping them to move their belongings in or out of the province. Effective tomorrow night at midnight, people may enter New Brunswick for a period of no more than 24 hours to remove belongings from a student's residence and to retrieve a student. They are expected to observe all public health rules and minimize contact with others, except the student they are picking up while in the province. Anyone traveling to pick up a student in New Brunswick must register their travel at gnb.ca/travel registration. Staying longer than 24 hours is considered remaining in the province, and the 14-day self-isolation period would then apply. Before traveling to New Brunswick, people should check with their home province to see if further restrictions may be applied upon returning home. New Brunswickers may enter Prince Edward Island, Nova Scotia, or Newfoundland and Labrador as long as those provinces permit them to do so for no more than 24 hours to remove belongings from a student's residence. They are expected to observe all public health rules and minimize contact with others while away, but will not be required to self-isolate upon their return. Students returning to New Brunswick after living in Prince Edward Island, Nova Scotia, or Newfoundland and Labrador will not need to self-isolate upon their return. Anyone leaving New Brunswick to remove belongings from a student's residence located outside the Atlantic provinces, is ordered upon their return to self-isolate for 14 days and follow directions of public health officials. Students entering New Brunswick from outside the Atlantic provinces are ordered to self-isolate for 14 days upon their return as well. More information about this is available on the GNB website under travel registration. Before I close today, I want to draw your attention to the yellow daffodil pins we are all wearing. The Daffodil campaign in support of the Canadian Cancer Society takes place every spring. Due to the pandemic, the Cancer Society, like so many other nonprofit organizations, have had to change the way they fundraise. As a cancer survivor, this organization is one that is close to my heart. I know I'm not alone in this, as most of us have been impacted by cancer in some way. During the month of April, I encourage you to support the Daffodil campaign and the Canadian Cancer Society in whatever way you can, whether it be by sharing a post on social media or making a monetary donation. By doing so, you will be helping to provide much-needed hope to Canadians living with cancer and their families. If this pandemic has taught us anything, it is the importance of having hope during challenging times. Thank you. Merci.
Thank you, Mr. Shepherd. Dr. Russell, merci beaucoup, Ms. Shepherd and Dr. Russell. We'll now proceed with questions from members of the media. Each reporter will have one question. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question. Voulez-vous assurer de désactiver le son de vos micros? Dave Coach, Brunswick News.
Hi. This would be a question for either Dr. Russell or the Minister. Premier Higgs said on March 26th that he's looking at whether migrant workers might get the vaccine in their country of origin after the issue was raised by the advocacy group known as Illegal Fredericton. Dr. Russell, you said in your interview on Sunday, our situation is different in New Brunswick from other parts of the country because we haven't seen outbreaks among temporary foreign workers. Will temporary foreign workers have access to the vaccine in New Brunswick, and if so, when?
All I can tell you is that the Atlantic provinces, maritime provinces have been talking about how to safely have the temporary foreign workers self-isolate when they arrive and be tested. Again, what worked last summer worked really well, so we weren't planning to deviate from that plan at this point in time. But as is the case throughout the pandemic, as things evolve and we get new information, we'll use that information to make new decisions. But as of right now, we had a very successful outcome with respect to how everybody was safely self-isolating. So I know, again, our conversations with our counterparts around the Maritimes as we do continue to plan to do that this year as well.
Thank you. Vicky Hogarth, CHCO
Is
TV.
it unfair that someone could be coming from a poor country such as Jamaica, Guatemala, or the Philippines to work in our fields without being guaranteed access to a vaccine?
David, the doctor did answer it. Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question is for Dr. Russell. Just for clarity, more young people are contracting the variant due to its increased transmissibility, and that's part of why hospitalizations are up for younger people. But are the symptoms in general also more serious and the risk of death higher with the new variant for all individuals, but in particular for younger people?
Well, I think there are several factors at play right now. When you look at other jurisdictions, they have seen, very severe symptoms in many different age groups, but younger than what we would have seen prior to the UK variant. And then what you're also seeing confounding that is the fact that we have our older populations in nursing homes and long-term care facilities vaccinated with at least one dose at this moment. And so the type of situations that we would have seen before with those populations being hospitalized and having ICU admissions and deaths is not the same. But overall, the UK variant as well as the P1 variant are more transmissible by somewhere around 30 to 40% or up to 70% depending on what data you're looking at. And in terms of the severity of symptoms, again, I wouldn't necessarily say they're more severe, but they are affecting people in younger ages. What we used to see in the pre-variant COVID, we would see that starting at around the age of 50, you would start to see an increased risk of hospitalization, ICU admission, and death, and it went up almost exponentially after probably around age 70, and so each 10 years, it would go up, but now we're seeing that same type of curve has now dropped to 29 and above in terms of starting to see the severity of those symptoms and the requirement for hospitalization and ICU admission.
Thank you. Jean-Philippe Hugues, Radio-Canada.
Jean-Philippe Hugues, Radio-Canada. Hi, my question is for Dr. Russell. Vitality Health Network shares reports about intensive care in the Edmundston Hospital. Patients are now being transferred to the Chalmers Hospital in Fredericton. How many patients can the Chalmers Hospital admit? And if Edmundston is full, what's the plan? I'll give you an answer first, and then Minister Shepherd can answer after. This weekend, the RHAs, Ambulance Nouveau-Brunswick, and Extramural, and the Department of Health got together to discuss the plan to transfer COVID-19 patients. The point was to make sure that we had capacity as more people needed hospitalization. The goal is to reduce risks at this point. We'd like to see a reduction in case numbers, and we're starting to get there in Zone 4, but there are still active cases. This means that at any time, these active cases can develop more serious symptoms, and so we're prepared for that eventuality. But I don't know the amount of beds that are available, what the capacity is, and where we're going to send patients exactly at this time.
I will just add that, the Dr. Everett Chalmers Hospital in Fredericton has capacity to help with some overflow. And so it's very important that we utilize our resources where they are. We have a provincial healthcare system and provincial hospital network. And so we will work in tandem with our partners in whether it be Fredericton, St. John, to ensure that we're meeting the demands that are put upon it. And operational plans are in place. The RHAs are doing an exceptional job of working together along with Ambulance Nouveau-Brunswick and Extramural to ensure that we're able to meet that demand.
Thank you. Andrew Waugh, Brunswick News.
Hi, my question's for the New Brunswick Teachers Federation came out yesterday and said, red should mean learning at home. Have you consulted with the teachers, and what kind of reaction? I'd like to just understand the thinking behind the blended learning model versus going fully online until you've gotten this UK variant outbreak under control.
So, on a daily basis, the Public Health and Department of Health staff are in touch with EECD to talk about operational plans. And I think we've shown throughout this pandemic that EECD has been very nimble in reacting to any kind of outbreak or a diagnosis of a student or staff member at a school. And those high protocols will remain in place. We did make the shift to ensuring that if a school was in a red zone, they would continue at the high school level to operate with optional or intermittent days of students attending school to provide that little extra guidance throughout that time. But the EECD has I'm sure keeping in contact with their union and their organizations in order to maintain this not the status quo, but to maintain a serviceable work environment and learning environment for students. And so we, again, every single day, they have briefings, in briefings, out briefings twice a day, and all of this information is taken into consideration in the decision-making process.
Thank you, Mr. Waugh. Laura Brown, CTV.
Hi there, Dr. Russell. I'm wondering, I know that we were given the number ages of 25 to 80 that are in the ICU at this time, but I'm wondering if you can give us more of an indication as to if the average of the people who are in the ICU or in hospital right now are on the lower end or under 50, or how, if there's another way you can kind of illustrate for us, I guess, the gravity of who is in hospital.
Well, I know that we do have some more information on that. I don't have it in front of me. But in a general sense, I think what we're going to continue to see until everybody has 2 doses of the vaccine on board is that fewer and fewer people will have severe symptoms requiring hospitalization and requiring ICU admission. So that's a given. We won't see 0 cases, but we will hopefully see less severe cases. Again, that will mean less pressure on our healthcare system. And again, with the approach that we have right now that's targeted at where we're seeing the highest risks with respect to our vaccination, because we're unique in New Brunswick and we have, the importation of cases is the main risk right now, then we are targeting groups that can get vaccinated in that particular area. And we did move more vaccines up to Zone 4 to improve the vaccination rates up there. And again, I think we're going to continue to see what we're seeing in other jurisdictions, which is people aged 29 to 49 having more severe symptoms, requiring hospitalization and ICU admission. So we really want to have everybody protected so that older cohort of people that are getting their vaccines right now do continue to need to continue to follow public health measures to protect that population, because those are the people that are vulnerable as the older populations get vaccinated.
Thank you. Mia Urquhart, CBC.
My question is for Dr. Russell. We've heard that those under the age of 55 who received the AstraZeneca vaccine before the changed guidelines have not been notified or provided any information about the risks and symptoms, what to watch for. If this is true, why weren't they contacted with that information?
Well, I know we have information on AstraZeneca that is available. I assume that it's on the website, but I can confirm that. The other thing about AstraZeneca, again, we aren't booking second doses at this point in time for people under the age of 55 who received that first dose because we're still waiting for Health Canada to make their final assessment of the actual risks and benefits and age stratification specifically to Canadian population. And then, again, we've been following NACI guidance on that in the meantime. So there should be a fair amount of information available on our website as well as the Public Health Agency of Canada website around what the reported cases in the UK were and in Europe, and in terms of what symptoms to look for. But once you're past the 14-day, probably 3-week mark, those cases that were reported happened within 5 days to 21 days of receiving the vaccine. So anybody who's beyond that window is not at risk at the moment for that very, very, very rare clotting event.
Alexandre Boudreau, l'Acadie Nouvelle.
Alexandre Boudreau, Acadie Nouvelle. My question is for Minister Shepherd. I heard that about 10 vaccination clinics organized by Vitality were postponed because there wasn't enough vaccination. I don't know. Are you saying that you need to inform people better about whether they should be vaccinated or not? These clinics were postponed. Is there any information on how you should proceed for these postponed clinics?
Had over the last couple of weeks some Moderna shipments that were not arriving in the time frame that we were expecting, and so clinics that were booked did have to be postponed. We also, I'm not sure if these are related to the specific clinics you're talking about. We also had a glitch online that with the online registration, that's been repaired as well.
Travis Fortnum, Global TV.
Hi there. My question is perhaps best answered by the minister. I was just wondering if we have numbers of how many doses of any of the vaccines have had to be discarded, either because appointments were no-showed or because the doses themselves were mishandled.
I don't know of any doses that were mishandled, and with regards to any doses wasted, it is extremely low. I'm sorry, I don't have the exact number. We will check on that for you, but I'm understanding that it's an extremely low number. Pharmacists have backup lists and backup lists and backup lists, as do the RHA clinics, to ensure that we do not waste dosages.
Thank you. Marie-Ève Arsenault, Radio-Canada.
Marie-Ève Arsenault, Radio-Canada. Hello, my question is for whoever can answer it. Pharmacists are saying that they got a memo from Public Health saying that there would be a reduction of vaccine shipments. There have been consequences. Some clinics had to be canceled, and there was a slowdown in vaccinations for the next 2 weeks. What are the reasons for this reduction in shipments?
So I'm going to take that. As you can imagine, this is a global effort. And so I think Moderna comes out of Europe, and there have just been a couple of delays that we've had to deal with. We've had Moderna shipments that have not shown up at the times that we had planned for, which is one of the reasons that we try not to plan appointments at clinics until we have a confirmation of the shipment. But as you can appreciate, this is a very quickly evolving situation. In fact, when you think about it, we're planning on having our entire province vaccinated by the end of June. And so you can imagine that when there is a hiccup in the delivery of vaccine, it may create some difficulties. But the pharmacy and the regional health authorities are doing a great job in getting the vaccine that we have into the arms, and we're very appreciative.
Lindsay Armstrong, All Nova Scotia.
Thank you. I'm wondering what percentage of the current active cases are variants, and I'm wondering about the timeline and how long it takes for these tests to be identified as variants if they're going away or if this identification is happening locally. And a question for the Chief Clinical Officer.
So most of the cases in Zone 4 are the UK variant. We actually have the ability at our lab in Moncton at the Georges Dumont Hospital to be able to give a proactive, presumptive, thank you, a presumptive positive for a variant of concern at this moment in time, which is really great because when we send it to NML, it takes about a week to get that confirmation. But because we can give those preliminary results, the presumptive result, then we can get a turnaround time much more quickly, I'm assuming within 24 to 48 hours. And we have 119 cases of the active cases that are confirmed to be the UK variant or presumptive.
Bobby Jean McKinnon, CBC.
Yes, thank you. My question is for Dr. Russell. We've heard a man in southern New Brunswick is being treated for a blood clot after getting the AstraZeneca vaccine, which we understand would be the first time this happened in Canada. Can you confirm, and what is his condition?
I can't confirm that because I haven't received that information.
Simon Delattre,
Simon Delattre, Acadie Nouvelle. The question is for Dr. Russell. Does public health think that is public health considering accelerating vaccination in Zone 4? Will more doses be available? Will they bring down the age of vaccine candidates?
On a déjà accéléré le programme de vaccination dans la zone 4.
We have already accelerated our vaccination in Zone 4. 28% of the population has been vaccinated in that zone. That's higher than elsewhere in the province at this time. This is our response to the outbreak with the UK variant. We're continuing to make efforts to shut down this outbreak, and we want to make sure that people in that zone continue to follow public health guidelines.
Global TV.
Hi, thank you, Bruce. My question is for Dr. Russell. Dr. Russell, with the death of the individual over the last few days who was in his 30s, how concerning is this for public health and for officials dealing with this with this situation, because we haven't seen someone in that age range succumb to symptoms to this point. So it's always been an older person. You certainly don't want to see anyone pass, but when it's someone who's who's in that younger age range, and when we're seeing more severe symptoms for people who are getting the variant, how concerning is this for people that are within that age range? How should people in those age ranges be reacting to this?
Well, again, we've gotten so much information from other jurisdictions that we have been basing our messaging and our approach to how we react and respond to outbreaks of the variant as a result of that. So we've known for a while now and have been trying to message for a while that the UK variant does affect younger people with more severe symptoms and needing hospitalization, ICU admission, and can result in death. So, prior to the UK variant arriving, most of our deaths occurred in people 70 and above. I think there were only 6 cases out of the total number of deaths prior to that had been below the age of 70. And so this recent death of an individual between the ages of 30 to 39 is very, very sad. And we are very concerned about the fact that we don't want anybody else in that age group to suffer from serious outcomes of COVID-19. We are in a race against time right now with respect to the vaccine rollout, and we have known all along that this is going to be the most critical time during the pandemic, which is not ideal because this is the time when people are tired. The spring is coming. They want to get outside. They want to be with their family members and their friends. It's very, very difficult at this time to try to see the finish line and getting that one dose of COVID-19 vaccine into the arms of all people in New Brunswick who want to have it by mid-June. So between now and mid-June, I do expect to see more cases of this variant, and I do expect to see cases of the P1 variant in our province. I don't want to see any more bad outcomes, but again, we are doing everything we can with respect to our border measures and our restrictions on traveling. We are trying to do everything we can with the limited supply of doses of the vaccine that we do have. So that is why we need the entire province to work together right now to protect our entire population. We did manage to protect the most vulnerable in nursing homes and long-term care facilities, but there are vulnerable populations now as a result of the variant and as a result of not having all the people that we want vaccinated at this point.
Thank you. Michel Corriveau.
Michel Corriveau, Radio-Canada. Hello, thank you, Bruce. My question is for Dr. Russell. Some parents and youth associations have said that they are concerned about returning to school next week. It seems even the Minister of Education is concerned. What would you say to parents and youth? And did the minister talk to you about his concerns? I'll let the minister answer, and if I have anything to add, I will.
So thank you for that. I speak with Minister Carty almost every single day, and we are aligned with our decisions that have come out, not only recommendations with public health, but also with the all-party COVID Cabinet Committee. This is a concerning time. There isn't, and there's no perfect plan. We mitigate risk. We do the absolute best we can with protocols and safety protocols that are in place to operate. But it is EECD has done a tremendous job in being able to ramp up, ramp down with school openings and closings and minimizing any kind of fallout from a potential outbreak or an outbreak. So we are aligned in this. Thank you.
I don't have anything to add.
Marie-Ève Brassard.
Marie-Ève Brassard, Radio-Canada. Hello, thank you, Bruce. My question is for whomever wants to answer. Regarding the clinics in pharmacies, my question is about appointments. You're saying that people have to call drugstores to make an appointment, but there are many pharmacists that are completely overwhelmed by the calls. They have to dedicate staff specifically to manage these calls. Should we ask pharmacies to call the public instead of the other way around? Have you contacted pharmacists before telling everyone to do this? There's a huge burden that is being placed on pharmacists from the administration standpoint.
Absolutely. We have had very, very significant dialogue with the pharmaceutical associations and with pharmacies as this rollout has happened. Pharmacies are managing extremely well, I think, on average. And if there is anyone struggling, I know that our department would be happy to work with them to work through those challenges. I know many pharmacies had a registry where people could register online to be called for a vaccination clinic appointment. And I know that many pharmacists have proactively reached out to their client base, throughout the age cohorts and with the AstraZeneca clinics to be proactive about it. So I think that right now we have a very balanced approach to this, and they are getting the vaccinations in the arms of our citizens, and we're appreciative.
Let's see. Tom Bateman, Brunswick News.
Thank you, Bruce. Good afternoon, everyone. I was speaking this morning to a woman from Amherst
has been told that she's not allowed to attend a visitation ceremony for her daughter who died suddenly. The ceremony is this coming Saturday in Moncton. She's told the issue is that the family isn't planning a formal funeral, but something similar to a wake that would still comply with the operational plan at a funeral home. She only wants to attend the ceremony and then return directly home to Amherst under rules that seem similar to what an end-of-life compassionate exemption would be, as they're described on the GMB website. Is there any hope for this woman to be allowed to cross the border solely for this visitation? And if there isn't, then can you just describe why the rules must be so rigid, particularly with the low case count in Cumberland County and the fact, that travel restrictions aren't being reciprocated by Nova Scotia right now for people traveling in that direction, that we seem to be on the cusp of the Atlantic bubble, and that, as you just announced, there's a new exemption for university students. Thank you.
These stories are very heartbreaking, and it's not been easy. It's not been easy for the task force that has to make decisions, and we can't speak for any advice that a funeral home may have given anyone. But I can say that we do have individuals who are tasked with looking at all of the information that's proposed and submitted by anyone for travel, and we have a process that's there, and I would hope that we would be doing everything we could within our risk evaluations to accommodate something like that. It's not easy, but I have to defer to that process and just say that we can't respond publicly to individual cases, but we do have compassionate processes, and I would hope that that's being followed properly.
Thank you, Mr. Bateman. Thank you, Minister.
Yeah, I just wanted to clarify. Bobby Jean McKinnon had a question. I haven't received anything in my inbox about that, but I have asked my staff to look into this, and if I have any more information on that, I will get back to you. And I know Laura Brown had a question around people vaccinated, et cetera, and I think, I'm not sure if it was Laura now, with respect to how many people currently hospitalized who've been vaccinated. So there are 3 of the patients who are currently hospitalized who have been immunized more than 14 days prior to the onset of symptoms, and there is 1 person who was immunized less than 14 days prior to symptom onset.
Thank you. That concludes today's update. Merci beaucoup. Voilà la fin de notre mise à jour. Thank you very much.